It's very important to document procedure notes whenever you do a significant procedure like intubation, giving surfactant, insertion of PICC lines, insertion of umbilical lines, lumbar puncture, any other significant test like suprapubic aspiration, for example. So when you do a note, you mention anything technically related to that, for example, the length of the umbilical line inserted, what level you are fixing the endotracheal tube, and what action was taken based on the X-ray review, etc. So this documentation is very important so that the team following you knows clearly that the line has been pulled, for example. The consent process I mentioned earlier, it's very important for medico-legal reasons as well. And most units, in addition to the general admission consent, would have a high-risk consent for the NICU, which is usually taken by the admitting physician. So the physician explains to the parents why the baby is getting admitted, what the likely treatment is, a quick overview of the duration of stay as far as we can predict, and so on. Any procedure not covered by the above high-risk consent or general admission consent would need a separate informed consent, and this you would have a policy in your unit for guiding this, and this can be verbal in case of emergency. Some units take for lumbar puncture, some units don't, but PICC lines, blood transfusions, these usually need consent, and when you're taking the consent for the first blood transfusion, you can always mention that we can proceed with further transfusions just by verbal consent. In case of surgical procedure, retinopathy treatment, etc., it should be the operator who takes the consent because they are responsible. They have to explain clearly all the complications that's expected from the process, and they should make sure that it is a really informed consent.